a revelation to use something like this in the consultation.
It changed the way they think about their pain. It was an educational tool. It very commonly brought out problems in their lives or their history or their experience of chronic pain in the past that they hadn't really ever considered might be relevant.
It focused me on actually what I was coming to the appointment for. I was homing in more on what was bothering me about that. Was it that I was unsure about the diagnosis? Was I worried that I was on the wrong medication?
What the toolkit and using that helped me to do was to look much more effectively at the patient's life, how it was affecting them and how I could specifically support them to make changes.
We so often hear stories of difficulties in communication, of relationships being characterised as difficult between patients and their doctors, for example, or their physiotherapists. And I think often if that gets off on the wrong foot, it can be quite hard to bring that back.
So many of us as patients and patients themselves find that consultations of any type can be quite anxiety provoking, partly because there's a natural power differential there, you know. You're a patient, you're going to visit often a very busy doctor, a very senior health professional, and there's perhaps a sense in this country that we don't, maybe as patients, want to rock the boat necessarily or upset, you know, the health professional. We're also quite keen to listen quietly to what the health professional wants to say, or the advice that they want to offer, or the treatment they want to offer. And I think all of that, plus, you know, a natural anxiety can sometimes combine to make patients have questions that they want to ask, but feel a little more reticent when they actually go in the door. You know, the sort of rabbit in the headlight sense that sometimes, you know, we get, and certainly, you know, when I've been in the role of a patient, that's certainly how I can sometimes feel.
When you've worked in primary care for more than 20 years, you develop a style of consulting that you become quite comfortable with, and the patients know your style. And what the tool enabled me to do is think a little differently, move into areas that we hadn't perhaps raised or discussed before. I was probably more supportive to the patient because the agenda was set by them, so their needs and concerns were addressed as the priority. The consultation for me as a GP was far more effective.
The things I had ticked that I was wanting to talk about, they were a brain fog person, they were already there written out. And they were written out in a language that the GP had read as well.
It enabled the patient and I to open areas and aspects of their life that were harder than they thought they were. So it brought to the surface things that we hadn't discussed previously. And that wasn't, we hadn't had good conversations before, but we were able to identify some real areas that they could make progress and address.
We always need to have sort of questions to ask if there's going to be a discussion. You know, that if we have uncertainties either about the nature of the questions that we want to ask, or we're too frightened to ask those questions, then the discussion's not going to be set up. And I think the nice thing about the toolkit is that it's not just about having some questions to go into the health professional and the consultation with. It's a validation of the normality of those questions. It's a little bit about, well, you know, this is a really important document, this is a validated document, and what we're saying is that these questions, you have a right to ask them, and they're an important aspect of your presentation.
I had 3 appointments, 1 a month with the GP, and I had felt that this had helped because we got straight to the point of what I was there for in the first appointment, and then there was a follow-up one. And knowing there was a follow-up one, it was quite reassuring to know that any issues I had, any problems I had, that I would be seeing the GP again.
If a healthcare professional perhaps has set up their appointment to guide the patient away from medication or guide the patient on to looking at mood or quality of life or activity, that may well be the main thrust of what the healthcare professional wants to do. But if a patient starts asking a little bit more about, can you explain to me a little bit more about what's happening in my body, then that tells the health professional that perhaps, you know, they're jumping the gun, for example, and that they maybe need to go back and either reiterate or talk a little bit again about some of the things that they may have asked in a previous session. And that's telling you something about where the patient is at, and it's useful because the healthcare professional can then guide what they're doing with the patient a little bit more according to where the patient is at.
We did get to things about managing my condition that weren't just about the physical sides, about, got to know about my home situation and should I be pushing my daughters to do more in the house, done in a humorous way, but she did get to know more about me.
One of the things that came back from the Barriers project was how difficult it was for healthcare professionals to broach some of these subjects. They often felt, for example, if they tried to start talking about how stressed somebody feels, the number of problems they're having with their emotions, how problematic that's become, it could be taken the wrong way. And you had some patients saying it felt like they were saying all of this was in my head.
For me, going with a chronic illness and you're going backwards and forwards, and it's every time there's an extra niggle, it's, well, I'll go and see if I can get this sorted because that's one less thing I have to deal with, that can be sorted. So I do feel a bit of a hypochondriac sometimes turning up. I'm sure it's not seen that way, but I do. So to push too far on anything, I'll tend to too easily go, oh, that's fine then.
But the doctors themselves and the physios are aware that this is a difficult condition to live with. It does cause emotional problems for people. We know that the rates of depression and anxiety amongst people with chronic pain are much higher than they are in the general population. And they're aware that that impacts on people's ability to cope. So anything that makes it easier for them to have that discussion, to start helping and supporting patients with their emotional problems, maybe signposting them to other services that are going to help them further, I think the better it's going to be for them and for everybody.
If we can encourage healthcare professionals of any type to use it perhaps as a way of giving permission to the patient that it's okay to ask questions, that it's really important to ask questions, and that no question is a bad one.
It's a revelation to use something like this in the consultation.
It brought out problems in their lives or their history or their experience of chronic pain in the past that they hadn't really ever considered might be relevant.
It focused me on actually what I was coming to the appointment for. I was homing in more on what was bothering me about that. Was it that I was unsure about the diagnosis? Was I worried that I was on the wrong medication?
What the toolkit and using that helped me to do was to look much more effectively at the patient's life, how it was affecting them and how I could specifically support them to make changes.